tonight we are going to be talking about female health. I'm going to start with puberty and go right on through menopause. So we'll just spend a little time on the puberty thing. Okay. Teenage girls that are just coming into their cycling and all that, the female formula is definitely something you can use to help them steady out their cycle and their periods. But what you want to do for them, one, the food program has to be good. No junk food. I mean, unless they want just to be one big walking pimple and a bad attitude. Junk food is really, really bad for teenage girls and boys, but I give up on them. But what you can do, and this is from Dr. Christopher, he says a girl approaching puberty should drink a cup or more of red raspberry leaf tea daily and the same of blessed thistle tea. These supply the estrogen materials her body will require. Continue to drink these throughout the teenage years. They taste pleasant and you can sweeten them and cool them in the refrigerator for a healthy substitute, soft drinks. So if you've got any teeny boppers around or the young girls coming into it, or even in their teen years, red raspberry leaf tea and blessed thistle tea are two delicious. They actually taste quite good, and that will help provide the hormone supports that they need, so that you will not have little demons on your hands through those years. Okay. For the cramping, and quite often the girls are not, their cycles are a little bit off. To help with, for suppress menstrual cycles, Dr. Christopher says that ginger tea is really good when the cycle isn't coming. That's just a real simple way to bring it back on. We do have a full formula that has been very effective in restarting cycles, suppressed cycles. I've had several women who came to me for help. Their cycles, one woman hadn't cycled in 10 years. She was in her 30s and she had gone through a traumatic rape when she was in her late teens, and her cycle had stopped completely. And she hadn't had a cycle in over 10 years. And it just took a couple months and we had her cycling again. Which one was that? Amenorrhea. If you got the handout on the different female formulas, amenorrhea is used to restart a cycle when they're not cycling anymore, and they still should be. This does not work when you're going through menopause and your body is definitely shutting down and you still want to have another baby. Amenorrhea is not going to help. Your body's going to do what it's going to do. But this will bring it back if it stops for other reasons. All right, for excess bleeding and PMS, those issues. Cramps. Some of the best things to clear cramps, and there's quite a few suggestions in the handout on menstruation, but my favorites are lobelia or cramp bark. Lobelia herb or cramp bark herb are excellent in calming cramps. That will clear the cramps, and usually within just a few minutes. As for PMS and heavy flowing, all those issues, or a period that doesn't want to end, all that kind of stuff, the female formula is excellent. If you really have bad bleeding, you can use the X-Men's, which is another combination of herbs. It has a little more of the wild yam in it, and it will help. Within hours, it will suppress the bleeding. But I can also do that with the female formula. It just depends on your preference, which ones you want to use. Let's talk about the excess bleeding part. Okay, here is what you want to do if you're bleeding and excessively bleeding. The female formula is normally only taken during the month when you're not cycling. So normally when you start your cycle, you stop the female formula and then you begin it again at the end of your cycle. And the normal dose for any female is 1.5 teaspoons a day. So let's say that
what?
1.5 teaspoons a day, and you can take it all at once. We'll talk about menopause a little later. So for regular cycling and all that, you take all your female formula one time a day and you're done. And it's 1.5 teaspoons a day. Unless you're really, really petite, then you might want to shave it a little bit. But for most women, I've had very few that have needed to shave that formula. It's 1.5 teaspoons a day. So you take this from the beginning of, from the end of your cycle until your cycle starts. When you start bleeding, you quit taking the female formula and you allow the cycle to happen. But let's say that your cycle comes and it's just gangbusters. I mean, you are just bleeding to beat the band, you're clotting, it's really, really bad. You can actually take a tablespoon of female formula and within a couple hours, it will slow the bleeding down. You're still going to have your cycle. We don't want to stop the cycle. We just want to slow down that bleeding. There's no reason to be bleeding, and you don't want to go on hormone therapy with the doctor because that stuff causes cancer, breast cancer, uterine cancer, all that stuff. Those hormones that you get from them are not safe. They're dangerous. But the female formula is made with the wild yam. It's a natural source, and there are no repercussions or fears from using that formula. When you have excessive bleeding like that, or let's say that you get to the end of your cycle, you've been bleeding for 5 to 7 days, it's time for it to be done, and your cycle goes, I don't think so. Well, you can take a tablespoon of female formula, and usually within just a few hours, you'll have the bleeding stopped or really toned down. If it's really bad, you may have to do that twice in a day. You know, you're going to play it by ear, and then you will continue with the higher dose for 1 or 2 days afterwards. What this is going to do is it's going to build up a wall, a progesterone wall against breakthrough bleeding so that you don't start bleeding again. It just, so you continue at the higher dose for a couple days just to build up that progesterone wall so that you do not break through and start your cycle again. That will end it, and then you go back down to your 1.5 teaspoons a day. We're not going to talk about menopause here, so we'll get to that and how this fits into that later. But that is one that you kind of have to play by ear. You know, if the bleeding is really horrific, you may need to go on for 3 days or whatever. Now, the side effect, there is one side effect that comes from using a lot of progesterone. It's nothing lasting. It's not going to hurt you, but you can get tender breasts. Your breasts can become tender. Like when you were a teenager and you bumped into the wall and walked away crying, the breast will become a little tender when the progesterone levels are raised like that. Once you drop your dose back down to normal in a day or so, your breast will not be tender anymore. No harm, no foul, no problem. It's just an adjustment. So don't be concerned about the tender breasts. Just know that this will stop the bleeding, and it's safe. It's safe to use. There's no lasting side effects like hormone therapy from the doctor. And talking about hormone therapy from the doctor, I am going to cheat and go ahead just for a second on this, since I brought that up twice. On the menopause info sheet, there's this one comment from Dr. Christopher. Question to Dr. Christopher's newsletter. Is there danger of overdosing with estrogen herbs for menopause, as known to happen with manufactured birth control pills, which sometimes cause clotting because of excess estrogen? He answers, no, herbs are assumable, and any parts unused is dispelled naturally. The inorganic preparations are accumulative, causing the side and after effects. So what you're getting from the plant-based herbs, if your body doesn't need them, it will just throw it off, and it will not accumulate in you. It just flushes on out. So you do not have to worry about the cancer, breast cancer, uterine cancer, and the other issues that come up from using hormone therapy, the drugs. All right. Any questions on cycling, on period cycling? Anything on that? I know most of us are beyond that or got that under control. So that was just mainly information for the young ones that come into our life. Okay, endometriosis. The program, does anyone here not know what endometriosis is? Okay.
I'm sure who have it, but I don't know what it is.
Okay, it's basically, just to put it what I think it's all about, it is basically a putrefaction of the lining of the uterus. The lining of the uterus becomes inflamed and basically infected. And I've always considered it to be, most of the women that I have worked with that have endometriosis were constipated for most of their lives. They spent most of their lives holding a bowel full of poop all wrapped around their uterus. And that just seeped through and it basically putrefied the uterus. And the lining of the uterus eventually became inflamed, and in cases of endometriosis, it will begin to slough off and start sticking on everything, and it's just extremely painful. It's a horrible situation. And so anyone dealing with that, I would suggest the Incurables program, a very strong infection program. And the female herb that we would use is the Newfem. Dr. Christopher talks about the female corrective formula consisting of golden seal root, blessed thistle, cayenne, catnip, false unicorn root, ginger, red raspberry leaf, squaw vine, and uva ursi. That is our Newfem. We make that formula, but we call it Newfem. And so that is the one for repairing and rebuilding the female system. And so it's not just for endometriosis, it's for anything weak. I mean, if you're trying to get pregnant, you're not getting pregnant, anything along that line where you want to rebuild and restore, the Newfem would be an excellent herbal support for that with the herbs that are in that one. But endometriosis is extremely painful. Is anyone dealing with that issue? Okay. All right. Well, then we can go ahead and breeze on by there. All right. Next thing I want to talk about is Pap smears. I'm not going to ask you if you get regular Pap smears. I'm just going to give you my opinion on Pap smears. Okay. All right. Pap smears are a very, very bad idea. What they are doing when they do a Pap smear is they are reaching up inside of you and they are scraping your cervix to get some cells off of it. It is wet and moist in there. All right. They have just scratched you up. And yes, you go in every 6 months and get a Pap smear. It's going to be inflamed by the second or third time. You're going to have an inflamed condition. Heaven knows what's going on. It can even become infected. They're just scratching it up and in a very moist area where it doesn't have a chance of healing. I mean, it's very difficult to clear up what they're doing in there. And for a good book to read on this, Dr. Mendelssohn's book, Medical Heretic, a Medical Heretic. Dr. Mendelssohn is the one that started Head Start. And he, in the 70s, he wrote a book, and I believe Amazon still has it in print. It's called Confessions of a Medical Heretic, something like that. And in there, he explains that there is absolutely no board of inquiry or nothing that tests or reviews medical procedures for diagnosis. Some doctor tries something, he writes it in a paper, other doctors begin using it, and it never goes through any board of study, it never goes through anything. So who in the heck ever said it was a good idea to take and scratch up a woman's cervix to find out if she had any inflamed or cancerous cells up there? I mean, if she doesn't the first time, she will by the second or third time. And it's not the brightest idea in the world. He also mentions in the book that there are quite a few deaths that come from procedures such as the barium enemas that they give for rectal or bowel, when they want to go up and take a look at your bowel, scoping the bowel and all that. That barium enema is that's radioactivity. They're putting radioactivity inside of you. That's what a barium enema is. These are not the brightest things to do. Just because everyone does it and all the doctors have been doing it does not mean it's a good idea. You have to use your own common sense and say yeah or nah. Same with mammograms. Whoever said that plastering your boob inside of that thing and squishing it down to nothing and then shooting it with X-ray was a healthy thing to be doing? Just think about things before they happen. If you do get a bad Pap smear and you need to clear up the inflammation or whatever that's up in there, you can do the garlic suppositories. That will normally clear that up and whatever is going up. What you do is you take a nice big chunk of garlic and you can take and run a piece of thread through it to give it a tail. And the first night, it's a 10-day process. The first night, you're going to just kind of bruise it up a little bit. You know, don't split the skin, just bruise it. And then you insert it and leave it in there and then take it out and you're done in the morning. Next day, you put one slice in it and you bruise it up and add a slice. And you put that up in you and spend the night with that. Third night, you put a couple slices. And basically what you're doing is you're mangling it more each night until you reach the place where it's comfortable, but any more mangling would kind of be burning you in there. We're so moist in there that the caustic properties of the garlic are not going to bother us in 10 days. You know, it's just going to be able to go through and clear up and get rid of the infection and the inflammation and everything that's up in there. So don't do it for more than 10 days. But what you're doing in the first few days is you're just finding out what's acceptable. So you start really slow with just kind of bruising it up and then slice it once and then just keep mangling it a little more each night until you find out, okay, this is as much as I want to take. And then that's what you do for the rest of the 10 nights. And that will pretty much clear up cervical inflammation and things like that. If you do have cervical cancer, well, we can talk about that in the Incurables program, but you would also probably be wanting to do this even if you had the cervical cancer to some degree to really support that area. All right. Any questions on Pap smears, or anyone want to tell me I'm crazy?
You're not crazy.
Okay. No questions on Pap smears? Okay. All right. The next thing I had on my list was pregnancy. Talking about pregnancy. Anyone here wanting to get pregnant or
No.
got grandkids, granddaughters, anybody who would be getting pregnant anytime soon?
No.
I know. I don't either. Well, there was one really good section in the pregnancy handout. I mean, anyone who wants to hear more on pregnancy, speak up now, or I'm just going to breeze right through it. The handout has got some really good info. It has a green drink that you should drink every day when you're pregnant. It's got it talks about the red raspberry leaf that you drink a tea every day for the last 6 days or the last 6 weeks of your pregnancy for an easier delivery. I wish I'd known about that. My delivery was not easy. It would have been much easier. Getting that little monster out would have been much easier. But there was an excellent section in here on heartburn during pregnancy. And this has some really good tips on dealing with heartburn overall. During pregnancy, of course, you're going to get a little more heartburn and stuff because the baby's taking up space that the tummy is, squishes the tummy up. So, that's one reason that a pregnant woman can get a little more heartburn than the rest of us. But the tips for avoiding heartburn are chew your food well. Don't gulp it down and take time. Do not drink with your meals. It dilutes the digestive fluids, and you already are having problems if the acid's coming up. You're not digesting well anyways. Increase your B vitamin foods, including whole grains, pure yeast, wheat germ, yogurt, perhaps acidophilus, which is another way of that's the older term for I can't think of it. My head's still trying to pound a little bit this evening, and it's just not going to think that deep. Don't smoke. Now, I think we all know that smoking, tea, and coffee just destroy the stomach. Those are things that are just, and also women, they need to know if you smoke, you are melting your bones. Smoking, just basically the acidity from the smoke, your body has to neutralize the acidity from the nicotine and all that's going in, and it draws the alkalinity from your bones to get rid of the acidity from the smoking. So if you're a smoker, you are just melting your bones away. They go up in smoke. Not a good idea. Papaya can aid digestion, fresh, dried, or in tablets. And we do have the papaya in the weight loss formula, which I can speak, it really does work very well. And it says some women take activated charcoal to absorb gases in the system. Slippery elm gruel will alleviate heartburn and absorb gases and toxins. So that is some good suggestions for eliminating that. One of the biggest reasons, if you're not pregnant, you don't have a baby trying to push your stomach in half, is probably that you need to do a liver flush. The heartburn in a regular person is the waste from the liver that can't get out fast enough. It's backing up into your stomach, and it's so acidic coming up there that it can be so bad that you can't even breathe when it comes up in your throat. Acid reflux is just horrible, and it just erodes the throat and the passages. So that is directly related to the liver being backed up. So if you've got acid reflux, heartburn, any of those things, you really need to clear your liver. In the meantime, one of the quickest things you can do to reverse that is a teaspoon of digestive tonic and a teaspoon of LP formula. That will end heartburn all but instantly.
What's LP formula, dear?
Liver gallbladder anti-parasite. I shortened the name to LP because I got tired of saying that big long name. But it's part of the liver flushing protocol. But you combine equal parts with the digestive tonic, and you have one of the most powerful anti-nauseas, anti-gases. I mean, if you are bloated with gas where you think your heart wants to explode and you're just miserable and all bloated up, you can take a teaspoon of each of those together in just a couple swallows of water, and in just a few minutes, you will feel that pressure easing and all the gas moving. And yeah, you'll be blowing wind, but it's better that it's moving out of you than being stuck in you. It's wonderful stuff for that, and it works beautifully on heartburn. And just the fact that it works so well means it's time for you to flush your liver. You need to do an ELF and get that liver flushed. Okay, I guess we don't really need to do cesarean C-section scarring from all that, adhesions. Anyone who would come across anyone that has a C-section and that has the adhesions from that, you want to do the 3-oil massage, olive oil, and I prefer just to use the BF&C, which is made with olive oil. It works really well. Trading it out with castor oil and wheat germ oil, 2 nights of each. And you just do that over and over again, and that will dissolve the adhesions, because when you have a C-section and they're cutting all those layers to go in, they can stick together when they're healing, and you can have adhesions between the layers so that the abdomen cannot move freely, and everything is kind of stuck in there. It can be quite painful for the women. And the 3-oil massage will dissolve those adhesions and really clear up that problem.
Do you mix all 3 of those oils together?
You use them separately. It would be like you would pack one for 2 nights. You pack the BF&C salve, which is your olive oil part of it, and then for 2 nights you would do castor oil packs over it, and then for 2 nights you would do wheat germ oil packs over it.
Oh, okay.
And each one of those has a different property. If you want to read more on that, go to the download the calcium absorption info sheet, because this is also what you use when you're going to be laying out. You would be doing the same thing, switching off the same way for laying out in the sun and sunbathing, which helps you absorb more vitamin D and gets the calcium absorbed better. You actually need the vitamin D and all that from the sunshine so that you can uptake your calcium and repair your bones and not have issues with osteoporosis. Okay, so all right. So I think the big thing that is our issues would be menopause-related issues. Anyone here still having hot flashes, night sweats, anything like that going on? Okay. All right. One of the issues that comes up with menopause is the heart palpitations. When the hormones are shifting and you've got a lot of fluxing of the hormones and everything that goes on during menopause, when things are shutting down and changing, you're having a lot of shifting in your hormones, this actually can make your heart go a little funky. And I've had quite a few women who will have racing heart at night, palpitations, things like that come on. What you can do if you're dealing with those kinds of issues, a bedtime, and it usually happens at night for some reason. If it happens during the day, you do it during the day too. But you would want your hawthorn tea and your cayenne tea, and a cup of that is your tonic before bed. And that will just prevent that from happening or stop it if it does happen. And that would be your 911 anytime your heart starts acting up, would be hawthorn and cayenne. A teaspoon of cayenne and a tablespoon of hawthorn is a hot cup of tea. And that can be used freely, providing that you are not on any beta blockers. If you're taking any drugs to slow the heart, you cannot use hawthorn. in this form. The hawthorn naturally helps the heart relax more completely between beats. So if you're taking a drug that is slowing the heart down, that drug is just going to take what nature is relaxing and force it to slow. So if you're using beta blockers, you do not want to be using hawthorn. And beta blockers are pretty bad anyways. Okay, hot sweats, night flashes. All right, tell me what issues you all are dealing with, female issues overall.
None of the above.
Okay. Libido?
What about cramps? Not cramps, but like joint pain. Joint pain in the thigh area.
And
In
libido's
the thigh? In the thigh area?
Yeah, like if I lay down on one side, it'll start aching. My right thigh will start aching. I have to switch over.
That sounds a little arthritic. Like you've got some arthritis in your hips?
I'm assuming I haven't been diagnosed or anything, but I find that seems to plague me at times.
All right. Women that are older, we all need a good calcium, the ability to absorb the calcium and the calcium absorption. If you are having an inflamed condition like that, where you're actually having pain coming up from it, the joint's inflamed. I mean, it's swollen to some degree. The bone, flesh, and cartilage formula is it's high in the phosphorus. You need twice as much phosphorus in your blood as calcium to uptake the calcium. So using the calcium formula along with the BF and C is going to greatly strengthen these issues. If the joints are inflamed and hot and they're causing you a lot of pain, you would probably want to pick up the arthritis formula. The arthritis formula has the nutrients in it that will dissolve the urea crystals. And the urea crystals, when they get in there, they are what inflame and make the joints hot and painful. So the arthritis formula, we call it A&R salve, or the arthritis and rheumatism formula. They're both the exact same thing. I just can't fit arthritis and rheumatism on our little salve jar. So we call it A&R for the salve. But they have the nutrients and nutrition that will dissolve the urea crystals and take down the inflammation in the joints. Once you've got that inflammation down, the BF and C is what's going to repair the joint. It has the nutrients and nutrition in it to go in and repair, rebuild, strengthen the elasticity in the joints. What you get often, especially when you get older, you'll get joints and tendons that are stretching out. You know, they're just not, the elasticity is wearing out. And the BF and C will actually strengthen the elasticity in the joints. You can pack the area. And I would really suggest packing it, you know, putting the salve on and just packing it and leaving it on overnight. If it's just a matter of of the joint just being stretched out and being worn out, it's amazing how quick that will repair.
Are you telling us that it's the formula tincture? And how much would you take if you wanted to go that route rather than the salve?
A teaspoon 3 times a day.
Of the A&R?
Yeah, the A&R or the BF and C, and/or.
Well, if you're trying to get rid of the crystals first.
Yeah, the A&R, a teaspoon 3 times a day is a really good dose. And when you're doing the formulas, you can take the BF and C at the same time you're taking the A&R. They can be taken at the same time. You just can't pack them both at the same time. When you're working with the salve, you got to pick one or the other. Okay, you can only pack one salve.
So the A&R formula dissolves the crystals. You can do that 1 teaspoon 3 times a day. And you can also do the BFC tincture, which will repair the joints.
Yeah, that actually does the repair work on the joints.
Okay. And how much are you doing of the BFC?
You can take a teaspoon every 3 hours throughout the day, which comes to a 5 times a day dosage. And that's a really nice strong dosage doing that. The day that I fell and tore my knee up, I took a tablespoon every hour all afternoon. I only say that just so you can see that in times of emergency, my knee never swelled up and I was never off of it. It kept it from becoming inflamed and actually didn't really even get all that sore. And I heard it rip when I hit the floor. When I hit the floor, I heard that tendon on the inside rip. That was not fun.
So if the pelvic area, hip, kind of that whole area of the lower back, I mean, that's what I'm having problems with, is my right, they're calling it the ilium, in a Latin word probably, but it's our hip that's connected to the pelvic. That whole muscle area, that whole is very tender for me. So I believe it's the arthritis or inflammation of something. But I'm not a doctor, I'm not a doctor either, but
I don't think we have to be. We just need to provide the nutrients and nutrition for our bodies to heal themselves.
Right. And so that's what you're saying, is that the A&R formula will.
Yes, it takes down the inflammation. When something is painful, one thing is, a couple weeks ago, one of my fingers, because I like to embroidery and work with my needle, and one of my fingers, I can't remember which one it was right now, but I didn't know it could hurt so bad. It was my index finger, just rubbing it. I remember which one it was. And it was seriously shooting pain. I could hardly even stand to touch it. And I wrapped it with the A&R salve in the morning. And by the afternoon, it was bendable. It was like there was nothing wrong with it at all. I was amazed at how fast it cleared up using that. I mean, I've had people tell me, but I haven't had any painful joints where I needed to use it before.
So basically, you would just use the A&R until, whether it was the tincture or the salve, until the pain was gone.
Right, right.
And
it's one to get, the BF&C is going to do the real work.
Okay, so, all right. So you do the A&R to dissolve it and
yeah, to dissolve the urea crystals,
get rid of
which
the
are inflaming the
inflammation, but
joint.
you can do the BFC at the same time, but you can't do the salves at the same time.
No, you can't pack them together. You
So
have
if
to
you
pick
were going
one
to
or
do
the
a
other.
pack, you would do the A&R until the pain was gone, and then you would start the BFC salve.
Correct. Salve packs, yeah.
Okay.
But you can be taking the BF&C all along, so you're getting a head start on it. You're just not concentrating on the area. When you take the BF&C internally, it just goes system-wide and just starts cleaning up everything. You'll be amazed at what it will remind you that happened to you years and years ago.
Okay.
When I first started using it, I had torn my arm up when I was 18, but I was using it because my back was in spasms. I was in a car accident in the mid-'80s and broke a vertebrae in my lower back. And so I had real bad back spasms. And so I'm taking it and using it to clear up the back spasms. And then I wake up one morning down the road and I can't hardly lift my arm. And my girlfriend and mentor had the presence of mind to ask me if I had ever injured that arm. And I told her, yeah, when I was 18, my boyfriend fell on me and he just ripped my shoulder up. It hit the ground and tore backwards and just tore all the ligaments in my shoulder. And it healed very badly. There were adhesions and it was just messed up. And she told me, she said, well, what's happening is the BF&C has gone in there. It's cleared up all those adhesions. And she advised me to wear a sling. I wore a sling for 3 or 4 weeks. And when it came off the arm, it had been numb for years. My hands were numb. The arm was weak. It's now as strong as the other one, and I have no more numbness in my hands.
So this is,
It
so
found that all by itself.
what about toes that have been hit, stub toes that are, you feel like they're numb now that you're 60 years old, that you probably dealt with for 30 years? Will that get revived through the BFC possibly?
It's called neuropathy, where you've got numbness in your feet and toes.
Well, I thought it was from me hitting him so much with, you know,
That
how
might
you
have
stub your toe.
contributed to it.
What?
I said that might have contributed to it, but the numbness in the feet and toes is neuropathy. And what you want to do for that is your cayenne. Cayenne foot soaps, a teaspoon of cayenne per gallon of water, make it as hot as you can tolerate it. And you go between the hot and the cold, and you're just doing a circulation between hot and cold. And so you have ice water in one bucket, and you've got your hot water with your cayenne in the other, and you just do your foot soak between those. And it's wonderful, the circulation and all that. And that quite often, if it's just a milder case of neuropathy, that is usually enough. If it's major, you may need to get into the nerve regeneration formula and some of those others to rebuild the nerve tissue. But if it's just a little bit of numbness in your toes and all that, usually the cayenne foot soaks will be enough.
Okay. And how much cayenne in the
1 teaspoon per gallon of water. And it's hot water. As hot as you can tolerate.
Okay.
All right. Does anyone else have questions?
Yes, could you touch on, like, sometimes some women have like breast issues where it might be lumps, or they not necessarily cancer, but lumps or tenderness. I had heard that castor oil was good for breast issues.
Yes, it is. It will break up congestion. One of the things I need to make sure you all know, you all do not use antiperspirants, I would hope.
Deodorant?
Yes, I'm talking deodorant. The antiperspirant, deodorants are fine, ones that allow you to sweat but help mask the smell. But antiperspirants that prevent the water from coming out, those are dangerous. What they are doing is they are blocking up all these lymph nodes under here, which is moving the waste out of the breast. And the antiperspirants can be directly contributing to breast cancer in women because they are preventing the sweating and the waste that's coming out of the breast tissue. There's a lot of lymphatic, the breasts are all about the lymph system. And if it cannot drain well, when you're blocking it and preventing the waste from being moved out by putting antiperspirants under there, you're just holding all that waste in your breast. And it's amazing what you're going to develop from that.
So what can you use for odor?
One of my favorite things is I use Vagisil powder under my arms.
Ooh.
It absorbs the wet and it prevents the odor. Vagisil powder. I don't know if you all have ever heard of that. It's yeah, it's intended for the other area of the body, but it works great under your arms. And it's very drying. I put it under my breasts and under my arms in the summertime, and it really prevents me from getting wet.
Where can I get
it really helps absorb the fluid. Pardon?
Where can I get it from?
A grocery store. I get mine off Amazon.
Walgreens sells Vagisil.
Pardon?
You say Vagisil?
Vagisil powder.
Oh, okay. I know Walgreens.
They put out,
Vagisil.
yeah, they put out a cream, but they also do a Vagisil powder, which it was intended to be used in the nether regions for women, but it works great. And it does keep you dry down there. I mean, if you've got issues with getting sweaty and all that, and It's great wherever you put it. It really helps absorb the moisture. It's wonderful. But that's my favorite thing. But they've got quite a few out there. If you go to a health food store and just look at the deodorants that they have,
Okay.
if it's just a deodorant, not an antiperspirant, you want a deodorant, not an antiperspirant, not something that prevents you from sweating. But that it's no problem with something, you know, that's going to go under there and keep the smell away. I mean, we don't want to stink. But you don't want to be blocking the fluid from moving, the waste from moving out of the area. And antiperspirants are one of the biggest reasons for block up in the breast area, because it prevents the fluids from moving out, and you block up all those lymph nodes. So let's say that, yes, Ken.
And in the antiperspirants and deodorants, isn't aluminum bad for you?
Yes, that's the bad part, the aluminum. I can't find you.
It soaks up through your skin, and it's hard to find them without it.
Yeah, it is, but they're out there.
You can find some product. Right, you can
Use baking soda
find
or
some.
cornstarch. Baking soda or
It's hard to find.
Baking soda is one. I think Vagisil may have something to do with baking soda. Not sure about that.
They don't speak out.
Any other questions on that or comments?
Yes, I have a question about, I have a lump on my back and underneath my left arm. I haven't had a mammogram because they were thinking that perhaps I have breast cancer. And I don't use regular deodorant. I don't use antiperspirant. I make my own. So I'm just trying to, I've started the incurables. Also, I have, I don't know if because of the fat that's in my liver, if that's contributing to the problem I'm having under my arm. But it's very difficult for me to move my arm.
All right. What we want to do for this case, and I was going off on that before I got to dealing with the lumps and the bumps and all those things. What you want to do to focus on that and to get the lumps down, the castor oil packs, M&L packs, I would switch between to get the lymph nodes down. Probably what it is a swollen lymph node under there. I would guess that you're dealing with a swollen lymph node. Could it be a swollen lymph node?
It could be. I did go to the doctor for it, but the first thing they told me that I probably have breast cancer.
Of course. Okay, well, let's just start from, okay, here's what you want to do to take down the swollen lymph nodes. You're definitely going to be doing the incurables. You're going to be liver flushing, because that's going to be the vacuum cleaner that's just going to pull that waste out of there. But you want to target it and get it unclogged so that it can move through there. Because if it is a lymph node, everything's clogged up around it and nothing's moving well. So the M&L salve, you can pack with that and put that underneath, put a castor oil pack on top of it. And that is really good, but switch between that and the charcoal flaxseed poultice. Okay. I've got the videos on doing the charcoal flaxseed poultice. That's just going to pull the infection and the inflammation out and just unclog it. And it's a little bit like doing hot and cold. The charcoal flaxseed, you apply that as hot as it can be tolerated, and you just leave that on all night, one night, and then the next night you can do M&L salve with the castor oil packs. And of course you apply a little heat to that before you do it. And go between those two, and at the same time you want to be doing your liver flushing and all the detoxing, that you need to do to get your liver pulling the waste out.
Okay. All right. Thank you for that. It makes a lot of sense. Thank you.
Okay. Now there is one other thing. If I don't know whether I posted, did I post the breast info sheet?
I didn't get any of
Okay.
it. I didn't get any of them.
All right. There is a procedure on the breast info sheet that we do if there are lumps and bumps in the breast. It's called the poke root bayberry poultice thing. And I actually have one of our members years ago did the procedure, took pictures for me on it. She was wonderful. We saw the pustulas, everything. She said when the pustulas were there, they were like filled with old milk. You know, they smelled like a rotten baby milk. You know, that was just being put, it just pulled the waste out of the breast. It was wonderful stuff. And this is just for the breast. I have that, I didn't bother printing that one off, but anyone who wants that procedure, I have it. You have to use fresh poke root that you grate. You're going to grate fresh poke root. Anyone that lives back here in the East, poke root grows everywhere. It's a weed that's pretty easy to get a hold of. If you absolutely can't find any, let me know. We can go dig some up out there. It's all over the place. But you're going to need a poke root, and you're going to have to grate that. And when you're working with it, you want gloves on your hands. It's pretty strong stuff. But that is a wonderful poultice. And from the woman who shared her experience, and the pictures and all that are on there are her. She did have breast cancer, and she did it. She got huge results and everything from it. And luckily, she did pass from breast cancer. She wouldn't do the emotional work, which was really sad. When you are dealing with yourself, when you are dealing with issues in your body and the emotional stuff comes up, you have to face it. You have to look those emotional issues in the eye and deal with them, or they will take you down, and you will not get the disease out of your body. Yes, Diane?
Well, I didn't say anything. That was my Alexa going off with a reminder.
Oh.
My Alexa remind me to do things, so that's she goes off at certain times.
Okay. Any questions on that?
You have to deal with the emotions.
Yes.
You mentioned. How do you have information on how you deal with that when you're going through a detox?
All right. It's really simple. You don't have to go digging for it. They will come to the surface. You're going to be talking stuff. If you want to if you want to do the work, to actually the emotional work at the same time, here's what I used to do. Okay, I don't think my history is a mystery to any of you. But okay, when I was doing my big work, and I would do free writing, but before I started the free writing, I would take some cayenne. Cayenne, God's herbs work on you emotionally just like they do physically. You will find that there's an emotional effect that goes with the physical effect. Where cayenne opens you up, gets circulation going in your body and all that, it also does that emotionally and spiritually. It is going to open you up. And whenever I would go see my psychologist or I would do my free writing, I would always use cayenne beforehand. And it would just open up and stuff would just flow out of me. I mean, it was amazing what would come out. And I would just start writing. On my free writing, I would just take a pen and I would just start writing. And sometimes, you know, you start out and you're just going, this is stupid. I don't have anything to say. There's nothing I really care about, you know, and you just start writing and nothing is censored. And eventually that pen's going to take off and it's just going to start saying stuff. And it's going to be amazing what flows out of you. And nothing is wrong. Nothing is censored. You just let it come. And you will find issues flying into that writing that you may not have even known you wanted to deal with. And you don't have to read it right then. You can just do your writing, fold it up, put it away, and look at it at another date. When you're done with all this, when let's say you're with your psychologist and you do your cayenne at the beginning of your session, then at the end of the session, so that you can just go back to your life and you don't continually deal with this, you take a couple dropperfuls of lobelia. Lobelia calms everything down. It moves everything to the subconscious, and that's where the healing takes place. When you are dealing with these issues, they actually, the healing happens on the subconscious level. We don't have to keep talking about it for healing to happen. It happens subconsciously. So what you want to do is get it out, take a look at it, become aware of it. Once you have actually looked at it and you have become aware and faced it, then you want subconscious to take and rewire, to do its work. It's going to go in there, it's going to start rewiring, changing your perceptions. You'll have some shifting of your thinking and all that. You'll just see these shifts that are starting to happen in your life in a different way that you're looking at things. And that happens on the subconscious level. So lobelia allows everything to settle back down and to go to the subconscious, so that you're not living in all that hurt, pain, whatever it is you're dealing with. It can just go back down where it was, and you can go on about your life and be your happy self. And life will, your subconscious is going to deal with it. One of an example of this is when we lose our parents, especially a mother. When I lost my mother, even though we were not close, we were actually at loggerheads most of my life. She was just something else. But when she died, I still had to pay the piper. I went through the period where I was just so sleepy. I mean, I just fell asleep. And what's happening is reality is shifting, and your subconscious is moving doing so much work to readjust reality for this person being out of it, for them not being there anymore. It's really doing a big shift. And so quite often after you lose a caregiver, you will go through a few months or a period of time where you're really tired, you're just bogged down, you can hardly think, you've got brain fog, you're just out of it. And that is your subconscious rewiring everything. It's like all the phone lines, trunk lines are being chopped off and rewired to go different places. Everything that had the support with them is now needing to be wired to somewhere else. And this happens on the subconscious level. So using the lobelia and the cayenne allow you to face. The cayenne lets you look at the issues, and the lobelia allows it to then go back down to the subconscious level where you can actually go on and function without it. And the free writing will let you see what the issues are. Just let it come out of you, flow out of you. Any questions on that, or did I confuse everybody?
No, I understand it, because I've been on urge for a long time, and I'm just not wondering why I'm not getting these healing results. And then I realized I had to work with my emotions. So for the last 4 or 5 months, I've been dealing with the emotional issues, and it's amazing how I understand that experience you're talking about, because every time it comes up, it's like this, it's this feeling that I get, and I don't care how bad the thing is that comes up, I'm able to cope with it better now when I wasn't able to cope with it before. So it's just like, it's amazing. The emotional healing work is just awesome to me.
Okay. There are herbs that will support the emotional issues. Skullcap is one of the most restorative herbs on the emotional side.
So how do you take that?
It's in the Nervine formula, is very good for skullcap. You can just make a skull cap tea, just using the herb by itself, but it's good in combination with other herbs that support its work.
Okay.
My favorite formula for it is the nerve food formula, which right now I can't make. I am still looking for a lady slipper.
So the nerve and nerve food formula, those are two different formulas?
Yeah, the nerve food formula is my favorite for emotional issues and emotional trauma. That is an excellent aid for that. Unluckily, I can't find any lady slipper right now.
So how can you substitute? What can be substituted for that into a
Oh, the skull cap. The skull
Oh.
cap is the closest thing I know to lady slipper. Lady slipper stands by itself. It's amazing. It's a wonderful herb, but skull cap comes in their second place.
Oh, okay.
By a little ways, but it's second place.
Okay.
I have two questions. I wanted to find out what causes fibroid tumors, and I know friends of mine who had those removed, but they came back. And
Yeah,
cysts,
they will come back if
and
you.
cysts also on the ovaries. Where do they come from?
All right, the fibroid tumors are the uterus info sheet deals with the fibroid tumors, and I like the way Christopher puts it here. In here, somebody had asked Christopher the question, is there a natural way to eliminate fibroid tumors? And his answer was, yes, there is. Yes, there is. A tumor is a swelling and abnormal formation of parasitic, non-inflammatory cells of tissue arising from cells of the host, yet progressive and independent in their growth. Tumors can be malignant or non-malignant. They can be fast-growing or slow-growing, and they can develop in many parts of the body, such as the lymphatic glands or nodes, the urinary and genital areas, or the abdominal structure. The cause of the tumors is an inability to eliminate unhealthy materials, and this generally stems from a lack of organic potassium in the diet. Begin by observing, basically, you've just got to get yourself cleaned out. It's the liver that is going to be moving the waste out. When the liver's backed up, and this is what the rabbit test from the 1950s that they did, and I've talked about this rabbit test so many times. The rabbit test from the 1950s, I think it was the American Cancer Society, had a bunch of rabbits and they swabbed their ears every day with nicotine. And then at some point they autopsied some of these rabbits. Okay, what they discovered, the long and the short of it, and yes, it was animal cruelty and all that good stuff, but they died. And so here's the good reason that they died. All right. What they discovered was that there were absolutely no tumors, no cancer formed in any rabbit until the eliminative organs have been greatly degraded. Translated, what this means, until they lost the ability to eliminate the toxins from their body, they did not form any tumors or cancers, even though they had nicotine swabbed on their ears. So if you rebuild your eliminative organs, support your liver, your kidneys, do the good food program, your body is not going to develop these issues. And if it has developed them, then we need to support the liver and the kidneys and the eliminative organs in getting rid of them. Questions, comments?
What about the cyst on the ovaries?
The cyst on the ovaries, you will want to you want to support the hormonal. You need to do the new Fem formula, and basically, because the cysts and tumors and things will grow in places where the body is weak. The body stashes garbage in areas where it's weak and the structure is not strong enough to prevent it from happening. So that's where the body will target and begin dumping waste in weaker areas of the body. So what you need to do is rebuild that organ with the nutrients and the aids and the herbs, the nutrients and all that help rebuild it. That would be the new Fem formula. The nutrients in the new Fem formula rebuild and strengthen the whole female system. So you would be wanting to use that to restore and rebuild the female system. And then you would do your liver flushing, your packs, castor oil packs over the area with your M&L salve. Just the whole procedure with the charcoal flaxseed, the M&L salve, all those things just to clear that out and to support the body and moving the waste out of there. And then of course the liver flushing, kidney flushing, all of that. And one of the biggest and most important things when it comes to anything with the uterus is you got to make sure your bowels stay open and working well, because they're wrapped all around the uterus. Mm-hmm. The colon, it just surrounds they're all just crammed in there together. Mm-hmm. And so if you've got a putrefied colon, it's just that putrefaction is just gonna seep into the uterus and everything is just gonna get putrefied, and you're gonna have cysts and boils and endometriosis and all this stuff coming up all over the poor little organ. Did I answer your question?
Yes. Because a lot of times, like, I think like when they like to take out women uterus with these hysterectomies, I remember something that Dr. Schultz had said years ago. When that colon is full, there's nowhere in your body for nothing to move. So if there's swelling, something always everything is touching anyway. Mm-hmm. So when that colon is swell, it falls when that uterus cut off blood supply, and the first thing you want to do is take out a healthy organ instead of getting that colon up off your uterus.
Yep. Yeah. And once they start pulling stuff out of there, they're going to unbalance everything, and everything just starts falling out the bottom.
Yeah.
I mean, I've tried to support women who, their bladder was coming out their vagina because the uterus had been removed, and the uterus kind of locks the bladder in place. And everything, once the uterus was taken out, everything just started falling down. And, there's nothing there. God had it all put in there for a reason, just the way it is. And taking out pieces is not a good idea. So, when tumors and tumors of any kind, it comes back to you want to target the area where the tumors are, where the swellings are, where the tumors are. You want to target that area with the packs, the M&L, the castor oil packs, the charcoal flaxseed, all of these things, just to get everything moving. And then your liver is going to be pulling that out. You need to support the liver with the flushing and all the the tonics that help the liver filter and purify the blood. And then do your liver flushing. And that is what's going to turn that around and get those things to go down. But you do need to target the area where the lumps and bumps are, so that the body will focus on those areas. Any other questions on that?
Yes, I have a question. You mentioned it earlier about why I wanted to find out why our libidos dissipate sometimes as we age.
Hormones, our hormone levels drop off. All that, we're basically hormonally driven. I was going to, I had notes here to bring up something that I had done years ago and found out how well it worked on my libido. While I was going through menopause, and I'm 61, by the way, and while I was going through menopause, I kind of lost interest a little bit, and things change and shift, and all this stuff was going on. And somewhere towards the end of all that, I had a breakout of boils. And yeah, can't remember. It was 16. I think it was back in 16. I had boils all over my bottom and backs of my legs. I could hardly stand to sit. And I would do the charcoal flaxseed poultice, get them drained, but they just kept refilling. So I went looking for something stronger, you know, and I found Dr. Christopher was not a profuse person. He didn't use adjectives, just, you know, throwing them out. You know, he was very literal in what he would say. And so when I read in his material that burdock root would quickly clear boils and carbuncles and things like that, I thought, okay, he's using the word quickly here. Let's see what happens. So I got some burdock root, and you only do it one time a day. Burdock root, it increases urine flow, and it increases the sediment in the urine. All right. So it's just a one time a day dosage. And I took a heaping teaspoon, I put it in my mug and covered it with boiling water. And I let it set and steep for 15 minutes, and then I would drink it. And I started that on Tuesday. By Friday, the boils were completely gone and they never came back. I mean, it was amazing. But getting down to the rest of the story is, what I found out was I became very interested in my libido just shot through the roof. I mean, this purifying the kidneys, my urine was super, super heavy and super dark, and I was just peeing tons of it. I mean, my kidneys were just pulling waste from everywhere and filtering really well. And when that was happening, my libido shot through the roof. My head cleared. I was just really, I mean, it was amazing, the change. And I was really surprised. And I think my husband was a little on the happy side because his wife was attacking him almost every night. It was like, honey, you need to come to bed. But you know, that was really a surprise, because for 3 or 4 years or better, while I was going through the worst of menopause, I couldn't have cared less. And that was directly related to the burdock root. And I stayed on burdock root 1 cup every day for about 9 or 10 months, that I just kept taking it. And it kept working really well.
So you can drink a cup a day continuously like that?
Yeah, it's not going to hurt anything.
Oh, okay.
And you just listen to your body. You know, one day if you wake up and you look at that cup and you go, you know what, I really don't want this, well, then you stop using it. You know, your body will tell you, your brain's going to say enough already. You know, that's enough of it. And but it was amazing how it just cleared out my mind, my brain, and it just brought everything up. And that was within, I'd say it was within 6 months of when I started losing the weight.
Oh, okay.
Within 6 months or so, because that was in 16, and it was August of 17 that I went on the food program and started the weight loss program, where I lost 240 pounds. So I feel that a lot of this stuff just kind of added up together. A lot of little things I was doing, the Lord just brought a lot of stuff together, and just it all just added up and brought me to the place where I was able to walk that walk and go down that road. It wasn't just waking up one morning and suddenly saying, oh, I think it's time to lose weight. There was quite a bit that went into that.
I have a question about the burdock root. This is Keisha, Diane's daughter.
Sure.
I was taking something that had burdock root in it. Hold on, I'm sorry. And I was diagnosed with having fibroids, and it made me spot more. Like it made it, I wouldn't stop bleeding. So was it the burdock root in the whatever I was taking? Well, you mentioned Burdock Root, so I didn't know if it had
Yeah.
affected you in a negative way if you had fibroids. Well, not negative.
Basically, yeah, it was probably detoxing you a little too rapidly, and you were not supporting the process.
Okay.
It's kind of hard to just Burdock root is pretty benign in and of itself.
Okay.
It is not a harsh. It's not one of these detoxers that like poke root or one of these others that is really, really harsh, and that you need to make sure you've got your echinacea and all these things to support the die-off in your body.
Okay.
I didn't find that burdock was that way, but it is a powerful stimulant to the kidneys. It really supports the kidneys in pulling waste out of the blood, the urea and all the waste from the blood.
I got scared and stopped taking it, so because I didn't know if it was.
Yeah. Well, what were the other issues that you were dealing with?
I was diagnosed with fibroids maybe 3 years ago.
Uterine fibroids?
Yes. She said that they were like the size of, well, when I looked it up, I guess it was the size of a raspberry, the biggest one, and then it was some smaller ones, she said, that showed up on the ultrasound. So I was taking some Dr. Sabi's feminine product, and it had burdock root in it. So when I was taking it, I just like bled. I spotted for weeks on it. So when I stopped taking it, then I stopped the spotting. So I didn't know if maybe it was.
All right. What happens? This is what you didn't understand. What happens when you're using the herbals to support it? Our female formula also supports getting rid of fibroids. And what happens is the hormones and all this, the fibroids will burst and slough out with your cycle. So if you are having excess bleeding and all that, you can use the female formula to control the bleeding so that it does not, because fibroids usually bring on excess bleeding. When you have fibroids, you're bleeding, over bleeding all the time. So you use the female formula to get that bleeding under control, but at the same time, what's going to happen is the fibroids are going to burst and then just flush out with your cycle.
Oh, okay.
So that may have been what happened. The formula may not have been complete enough to control everything that was going on. It may not have been. Sometimes they just throw something together and throw it out there on the market, I think, and just expect that they're going to make some money on it. And that's kind of sad.
Yeah.
But you don't have to put up with the excess bleeding, but there will be, when you're dealing with fibroids, there is going to be a lot of bleeding. The female formula will help control that and keep you from spotting in between times and all that other stuff. So you don't got to put up with it, but the body will heal, will flush it out. You do need to do the liver flushing and all that other good stuff to support the body in the process.
So would the liver flush be better before I start the female formula? Or
no, you start the female formula anytime. That's going to be balancing your hormones, and that will get the bleeding under control.
Okay.
So that if you've still got the fibroids, you probably still have heavier bleeding.
Well, that's the thing. I didn't know that I had them. I just had it was a freak moment at work one day. I had a normal, my cycles were getting longer, but I wouldn't say that they were like I didn't feel like I was maybe over bleeding, but this one particular day, it was just, and to the point that I went to the emergency room. And when I went to the emergency room, she told me, but it's not even now. I don't have like
yours are pretty small.
Okay.
I mean, I've had people who had them the size of grapefruits in there.
Oh, okay.
Big old ones. Yours the size of a berry.
Yeah.
That's pretty little.
Yeah.
And that's going to clear up pretty quick when you're doing the natural things to support it.
Okay. All right. That's
the female formula, your liver flushing, all of that good stuff
will help out.
Yep. That just clears it up.
Thank you.
Okay, any other questions? No problems, my dear. Any other questions?
Dara,
Yes, my dear.
we got to leave soon for something else, but I read a study 15 years ago that shocked us. There's 3 or 4 countries in the world that the women never wear bras. And there's
Okay.
zero breast cancer in those countries.
Mhm.
Yeah.
So,
They
Don't
probably
shoot-
don't use antiperspirants in those countries either.
Don't shoot me, but anyway, that was interesting.
Yes.
So anyway,
Yeah, some of
thanks,
those,
Dara.
the women are much more active and in a lot of those older and third world countries. We'll see you later, Kent.
Okay, thanks.
You're welcome, dear.
He's real good to sit through all that female issues.
His wife is there with him. That man is something else. I got to tell you guys, he is a full bird colonel. He's just one step under a general.
Oh, wow.
He's very personable. He's a wonderful man, and I admire the heck out of him. He's something else. So yeah, he sits through it, but he's very, very intelligent and really works with and helps a lot of people. He's a good man. All right. Well, have we covered this? Did we get through all the female stuff? I was a little lost because I know that our group here is a little bit older and the younger stuff wouldn't be all that interesting for us. Did I get it all covered good? Or did I miss on something?
No,
I
fine.
don't think so. I just
All
find that
right.
you have to do a complete detox and keep your
Yep.
system clean and moving, your bowels moving every day.
Yeah, and get the hormones balanced. And believe it or not, the female formula, the basic female formula goes from puberty right past menopause. I still use the female formula. If I don't, my libido will fall on the floor. You know, it just keeps you alive and active. It also keeps your skin from getting that old lady look. If I go too long without using it, my skin will start wanting to, what do they call that when it kind of crinkles? I can try and get that crinkly look, papery look on my skin if I go off my female formula for too long, and I forget to take it sometimes.
See, I had stopped taking female formula because I fell past menopause and I didn't need all that no more. So I was just my orders.
Here's a little secret a lot of people don't know. Anytime you are under stress or you take an emotional hit, your hormone levels are on the floor. They're gone, along with your immune system. All your immune cells, all that, everything just hits the floor when you take an emotional hit or you are under emotional or physical stress.
Oh, okay.
So yeah, we need hormonal support throughout our whole life, just to keep us balanced and keep us normal.
Suppose I'm going to get back on the female formula, huh?
Formula.
Well,
Formula is
we've lost a lot of the class. What would you guys like our next class to be on? You guys get to choose. You're here.
Well, one subject I think would be the brain would be nice.
I do too.
Brain.
How to keep it sharp and focused as we age.
Yeah, okay. That will actually get me back into my reading. I just got a case of books from Dr. Tim Jennings on the aging brain. And they're just giveaways for members that are dealing with dementia and things. And he actually has some really good suggestions in here on how to prevent dementia, what things that you can look for that people normally have that get dementia. And I just started reading it. I mean, I've seen this video. He has some videos on his website where he did some lectures on the aging brain, and it's really good stuff. And yeah, I can probably put something together on brain issues if that's what you guys would like to hear.
Yeah, because I like the difference between dementia and Alzheimer's, you know. Is there a difference between
Yeah.
them, or are they the same thing? Stuff like
I think
that.
it's pretty much the same thing.
Oh, okay.
Dementia, Alzheimer's.
So have you heard that Alzheimer's was actually diabetes 3? Have you ever heard that?
No, I had not.
Yeah, they
That
saying that.
wouldn't surprise me. I mean,
Yeah, they
diabetes
call-
really destroys circulation.
Yeah, they call it diabetes 3.
Okay.
Yeah.
I can see it because in diabetes, the vessels are just circulation is just gone. I mean, that's why the feet go and you get you know, the ulcers and all the issues with the feet, gangrene and all that on the farther parts of the body. So why not the brain also?
Okay.
That would make sense.
Okay.
It would make
I
a lot
wanna
of
keep
sense.
it- I understand from what I read, we should be able to think clear until the day we die, unless there's some type of disease in the body.
Yeah. Yeah, there's no reason for that. If you are doing if you're living a good life and you are dealing with yourself and you're doing the emotional work and just dealing with life and you've got the Lord there beside you, there's no reason for you to not be what you were. I mean, to continue to be vital and to actually do better. I mean, I'm actually better today than I was when I was in my 40s. You know, the Lord and I, we walked through a lot of stuff, the emotional work being done, I'm actually doing much better.
Because it's a shame that like, when we get a certain age, people feel like this is part, like all this hot flashes and stuff we go through menopause should be part of life, but that's not the way it should be. Just because you're older don't mean you have to be broken in body and spirit, you know.
No, you don't. No, you don't. We can definitely deal with that. Okay, well, I will put something together on the brain for the next one. Does
Okay.
that sound interesting to everyone?
Yes.
Yes, I would love to do it.
All right. All right, let's see
Okay.
what we can whip up on that. That's going to be an interesting one. Don't know where it's going to go. But you guys have a great 2 weeks, and I'll see you not next Tuesday, but the Tuesday after that.
Okay.
Thank
All right.
Thank you. Thank you so much.
Bye.
Everybody have a great night.
Bye.
Bye. Thank you. Bye, everybody.
Appreciate it.